and small households, the prospect of additional people through unplanned pregnancies may also aggravate the problems. How can people's mental and physical vulnerabilities be prevented during this time? We discuss in this episode of the Chiefs. Still episode of the Chiefs, and with us, of course, tonight are Ana Marie Pamintuan of the Philippine Star, Lucy Cruz Valdez of News 5, and Robbie Alampay of One News. Gentlemen and ladies, good evening
Good evening.
Good evening.
and happy weekend. Sorry, I can't help it.
Happy weekend.
Happy weekend. Ay, teka, ipasok natin ang guest. I don't think we have too much time here, so we have to bring in our guest kagad. Sorry, we have to cut short our usual. Pero our guest tonight is Miss Jean. Jean Goulbourn of the Natasha Goulbourn Foundation. Ma'am, thank you for joining us and welcome again to the Chiefs.
Good evening.
Good evening.
Thank you for having me.
Yes, ma'am. Ma'am, we have been hearing some alarming news over the past few months about what people getting depressed and people getting more anxious because of what's been happening, not just because of the lockdown, but as well what we can expect for the next few months or even years. People are parang in limbo. What have you noticed? What are the numbers that you've been noticing, for example, as far as your foundation is concerned?
Well, this lockdown and then what's happening with the pandemic, which is the illness of coronavirus causing us a lot of deaths, is a major concern for the whole world. We have a 37% rise, increase in depression, anxiety, panic attacks, insomnia, all over the world. That includes the Philippines. I can share with you a data that I gathered the past 4 months through the Hope Line. We have the Hope Line, and our calls have increased by 200, and there are weeks we increased by 220%.
Wow.
So currently, our calls are about 72 to 138 per day. And 50% of those calls are due to the COVID lockdown and the COVID, the COVID mortality rate. So we are
Ano
dealing
pong
with,
demographic profile?
we're dealing with different age group. What's interesting is we never had such a big age group of seniors calling us, but right now we have about 32% seniors calling, and they are locked in an apartment condominium by themselves with one helper. And then they have children all over the world. Some are in New York, Australia, some are OFW, some are nurses, some are doctors. And they really feel the loneliness. And then a few of them that reported they're on medication. So you cannot really say that they are really healthy at the healthiest peak of their lives. So they're on medication, they have chronic illnesses, and they are alone. Sometimes with a nurse, with one nurse and a helper in a condominium. So it chooses also no social status. We have callers who are grandmothers, and then they are very concerned about their own lives because they're living in very, very tight quarters, and there's about 12 of them in a tiny house. On the other hand, we have wealthy, retired people calling us up. A lot of widows, a lot of women, more women than men.
Oh, more women than men. That
Why is
is
that? Yeah.
exceptionally different because sabi nila it's the men who are more prone to being depressed because they don't usually express their loneliness.
Well, we have more female callers than men. I think men don't know how to call Hope Line yet,
Oh, that's
or
right.
maybe they must
That's true.
trust us a little bit.
Yeah.
So maybe they have to trust
Maybe
the Hope
maybe
Line.
that's a major factor there. The men don't usually want
Yeah.
to show that they're vulnerable or
You're correct.
they don't usually want to ask for help.
Yes, you are correct.
Now, Ma'am,
You are
Right.
correct.
I'm just curious on your side. Do you have the manpower to deal with a 200+% surge in calls?
That's a very beautiful question. Thank you for that question. We need support. We really do. Right now, I have 14 responders and 5 doctors. The five
Mm.
doctors are available for a 20-minute phone call for free. The foundation pays the doctors an honorarium for a 20-minute assessment. And then
Mm,
it's up to them to ask the doctors if they want a professional treatment via
mm,
telephone, via Facebook,
mm,
What kind of
mm,
FaceTime.
what kind of volunteers are you looking for? Because I
Um,
imagine that they would have to be trained at the very least. Because I mean, taking calls from depressed people, especially
yes,
those inclined toward taking their own lives,
yes.
that's
Okay,
a
Luchi.
very, very
The
risky thing to do,
the
right?
support
If
I
you're not
need are not
trained.
from volunteers, but it's from large companies. Like I need help
Okay.
from San Miguel. Like I need help from big companies that are helping COVID because my you have the frontliners who are taking care of sick patients in the hospital. But you can consider the responders. We have 14 to 16. You can consider them as auxiliaries. And since we're
mm.
working also, we have a project with OWA. And if it does continue for the OFW abroad, we're so lucky because Globe gave us 8 trunk lines and they
Mm.
gave us an international line where the
Mm.
Okay.
OFW can call the
All right.
Now,
Philippines.
Ma'am, I mean, you mentioned that a lot of these people who call, they do have families, they do have relatives, probably abroad, but at the same time, there may be people here, and we don't realize that our relatives, that our loved ones are struggling with something. What can we in the household and in the families be more aware of na baka pinagdadaanan ng mga kasama natin?
Actually, it's just a matter of being mindful about our relatives. Like, for instance, I have a 92-year-old aunt, and I personally feel like I should call her more often. And me, I live quite alone. I'm a widow myself. So it meant a lot to me that my sisters abroad were calling just to check how I was. And
Mm.
so the the kindness and the thoughtfulness within the family to
Right.
your cousins, to your aunt, to your grandparents mean a lot, especially if the calls come from little children, from their
Oh,
grandchildren, from
yes.
the
Yes.
Mm,
five-year-old or the 12-year-old. I hope
Yes.
that the parents remember their parents, their older parents who are within 60 to 85 years old, because that is where our callers are now. And it's shocking that about 25 to 30% of our callers are widows who live alone. Actually, I got teary eyed when I saw the report from Hopeline. And in Hopeline also, we need to add, thank you for your question, we do need to add about 8 to 10 responders. And I'm looking for funds. So I'm just happy if I could get some funds on the Gcash campaign that Globe started for us 3 days ago. And it does not matter how much. I just
Mm.
want to collect 1 million Filipinos that will give something, and I can tell the 110 million Filipinos, 1 million Filipinos care for you. That's
Okay.
more important than the amount.
Ma'am,
Ma'am Jeepy, you were telling us, you were indicating from the reports you've gotten from the calls that the really big problem here is the physical distancing, no? It's the loneliness.
Yes, the
And I
isolation.
think we
Yes,
can expect that this situation will be lasting longer, far longer than I think we are
yes.
hoping.
The
No,
second one, Ami,
yeah,
that concerns really a lot of people is the joblessness. For
yes,
mm.
instance, I know of 4 people who have to let go of their workers. Some have 40
mm,
workers, some have 200. Now, they can last only for 3 or 4 months with their emergency cash. But beyond that, it's going to be difficult. So, part of the anxiety that's hitting us,
Yeah.
we have about a million OFW workers coming home and they don't have work. So it is time for us, private citizens, civic organizations, companies, instead of doling out money for food, we can't do that for a year or 2 years. How about thinking of little projects of agriculture, plant, even if it's 50 square meter land, plant vegetables, plant something to help those unemployed. That at least they have vegetables, they have chicken, they have eggs, they have at least a poultry that they can count on for their family, you know?
What other
I,
possibilities are possible for psychological support? I mean, like
there are
community-based. We
five.
talked about family already.
Yes,
Community-based, or maybe from
Ami,
church or religious groups. What can you tell us
yes,
about that?
community based. But first, Ami, the most important is the individual saving herself.
Mm,
So the number one is what's very important is sleep. Insomnia is hitting a lot of
Mm,
people. I would say
mm,
50% of the population in America has been reported not being able to sleep. So what helps us sleep is less television, less video, and less telephone, less radiation from the phone. And I think it's really fresh air. That's why if you see me, I'm in Batangas. I
mm,
am recovering um,
mm.
a slight setback in Batangas
Uh,
because it's nature. It's a lot of air. It's a lot of air. It's a lot of sea, the ocean. You gotta go back to nature.
But
So
yeah.
nakakapagod.
Yeah.
please,
that's
Gene,
something that you
I'm just.
can do. That's something that
Mm,
you can do.
Yeah,
Something that escapes so many others. So
under
I'm
quarantine.
curious, how do you address somebody who calls you up to say that he's depressed about his job or he's depressed about the fact that he's alone? What are the initial counseling or advice do you give uh,
the
to
first
the
thing,
callers?
yes,
I'm just
the first
curious.
thing
How
we
do you
ask
address their
is
need?
we try to ask where are their pillars of support. Sino ang pinakamalapit sa inyo? Sino ang pinakamahal mo? Pwede ninyong tawagan.
Uh,
Pwede kayong maghingi ng tulong na nalulungkot kayo at nag-iisa kayo. The second one we teach them is breathing exercise. Because when you come to a panic attack, you have to learn how to breathe first.
oh,
mm.
And breathing means uh, 5 seconds, very slow intake of breath,
Inhale.
and
Mm,
5 seconds of holding it. So you have some carbon dioxide on your brain, and then 10 seconds of slowly releasing your breath. We
mm,
teach that on the phone. We
yeah.
teach them, we
mm,
start with 4 seconds and then 7 seconds out. Then we
mm.
teach them 5 seconds
But
because most
Gene,
people breathe very shallow, and that
mm,
starts our panic. It starts
Yes,
mm,
palpitation, it
yes.
starts
mm.
dry throat, and we tell them to drink a lot of liquid, which is
Mm,
water. And we
Mm,
tell
mm.
them
Gene,
to
I'm
imagine.
curious about. Mm.
We
I'm
have to
curious
tell
about the
them,
I'm
yes,
sorry. I'm curious about the insomnia that you mentioned.
yes.
Is that particularly hitting just an older demographic, or are we seeing that even in young kids? Because nabanggit mo yung TV, nabanggit mo of course sitting in front of the phones, sitting
Opo.
in front of computers, and I
Uh-huh.
think many households, many parents can relate with this, di ba?
Yung young kids
Their
po,
children, are we seeing it in young children as well,
yes,
in
a
young
lot.
people?
We have 12
Mm,
years old calling us up. They cannot sleep also, and they are addicted to video games. Now, if you
mm,
look at our international news in the past 3 weeks, there were two
mm,
suicide of 12-year-olds. They
Yeah.
hung themselves in the closet, one, and the other one hung himself in a room. And that was because
because
they lost in a video game that they have been playing, and they would sleep only 6 hours, and they would be on the video game for 12 hours a day, and they lost.
oh
So for
wow.
3 months, the father said, I bought him the best video game. I spent $300 on the video game. I wanted to support my 12-year-old child who
Mm.
couldn't understand why there was a lockdown. And the
Mm.
father was crying on television and saying, "Don't give your children video games." The
Mhm.
father was begging other parents to understand that video games can cause a terrific um, burnout on the brain and cause a child not to sleep.
I see. So earlier you were saying that seniors usually can be addressed by a little mindfulness on the part of family members. How do we deal with children who, especially those who are already so into video games and even online internet stuff? And so many millennials and Gen Zs are already there. How do you deal with them, or in an effort to preempt depression setting in, or aloneness, which usually
Yes.
they don't recognize when they're alone with their computers. So
Well,
how do
there
you
was a
deal with that?
beautiful sharing, Luchi, from a family. And the parents said that they had 7 children. So the sharing was like this, that 30 minutes before the meals, they got together and each one had 3 to 5 minutes of sharing of
Mhm,
the what made them happy for the day and what
mhm,
made them very sad. And this was
Mm.
normally done at about 5:30 or 6 in the evening before the meal, before the dinner.
mhm,
And then so there was a communication, and a communication was established by the parents. So what happened also is that the parents brought in old games like like Monopoly, like
oh,
the game called Sequence, like the game called Scrabble, and they would take bets. And
okay.
within that, from playing 1 to 2 hours, the games became like 3.5 to 4 hours. So there
Mhm,
was a more communication between the siblings and the
mhm,
Mm.
parents, and less looking for the video games online.
mhm,
But it took a lot of effort for this couple who explained to me what happened to their family.
mhm,
Maybe it's really a big effort. And then whatever religion, you can be a Buddhist, you can believe in Allah, whatever religion, just bring the family together for a 20-minute prayer for each other and for others, and let them know that the others have even a more crucial life than what they're living, you
Ma'am
know.
Jeannie, the government is
Yes.
planning to reopen classes on August 24. You think this will be good for the psychological health of students, or will it create more anxiety? Not,
Okay,
not
there's a
only among the
country.
students, but among among the
Okay,
parents as well.
there's a country po, Ami, uh, I think it's Scandinavian. I'm not sure if it was Sweden, but I belong to the International Association of Suicide Prevention. And one of the sharing that they had for the COVID is that the schools decided to do an alternate. So MWF, they only had 12 children, and CTHS, they had only 12. And
mhm,
what they did is the setup of the school. Instead of in a locked up room, they did it in nature.
mhm,
Nandun po sila sa park. Nandun sila sa hillside. Malapit sila. And then they didn't stick to academic
subjects.
schooling. No. They changed the
Oh,
academic. And this happened to my granddaughter. And I'm very happy to share this. So they have different classes. And do you know what they did in their classes? Instead of just reading and writing, they did
Mhm.
puppetry, they did painting, they did poetry writing. So
mhm,
anything to do with the arts, music, a lot of music in the ears. It
mhm,
really helped the children. Please believe me that
mhm,
if the school teachers, if Dep Ed would bring back singing and dancing,
mhm,
the children will feel better than subjecting them that you're grade 4, you have to accomplish this, you're grade 7. Forget it. Let's
mhm.
not talk first too much academic. Let's just
Let
talk
me ask you
about
about
emotions.
Ma'am, let me ask you about this work from home setup, which is now becoming the new normal.
Yes,
At the
sir.
outset, a lot of people thought that it would be less stressful for people because they'll be at home, they'll be with family and all that. But it's turning out that for a lot of people, it's also more stressful kasi kahit pa paano yung segmenting your work from your home time and your leisure time helps to distress people. Eh. Now it's all merged into one long day of work
You know who's having the
and
hardest
home.
time?
Apo.
You know, sir, who's having the hardest time? It's the men. The men are not
Oh.
used to staying home, and they're not used to hearing their wives talking every day. It's the men. The men need help.
Ma'am
Totoo
naman,
ba
ibig
yan?
sabihin yung babae may kasalanan. I object.
Luchi,
Hindi
kayang-kaya
sa
ng
amin galing yun.
babae.
Totoo ba yan?
So, pero ang
We had
nakakatuwa,
nothing to do with
Luchi,
that.
ang nakakatuwa, yung mga 35 to 45-year-old na mga, I call them the new metrosexual dads. They've learned how to cook, and their cooking is fantastic. They exchange recipes with the other male friends. That's their part of release. And then
Yeah.
they do bike. They're selling now a bicycle where there's a big screen and you can see yourself riding through the forest, but it's all very visual. So the men are buying this gadget, and it's one of the biggest gadget in America that's sold out to men who are forced to stay home.
But,
So
but
I
then
hope that we
again,
can buy that gadget here.
but then again, these are all well for those who can afford. But for the majority who are probably cooped up in their tiny, let's just say 20 square meter
Yeah,
studio or
it's hard.
condo or apartment, what can they do realistically to entertain themselves outside of online videos and
Okay,
games?
for the men,
Yeah.
Lucci, for the men, I suggest that there are men who are very musically inclined. Maybe they can buy a drum. Maybe they can buy a flute,
No,
a
that's
saxophone, a
stressful
guitar.
for your neighbor if you have a drum.
I know, but the drum is the biggest for depression. It's the
But,
biggest outlet
but
for
it's a
depression.
space eater. Oh my.
Oh
Yes,
my,
I know
really?
it. What
Really?
about a
So,
guitar? Pick up a
the
guitar and do it,
guitar.
right?
Or a
Yeah, but
harmonica na
you
lang, di
can
ba?
do, ang
Mm.
Filipino
Yung
music
ibang
natin,
tao
hindi
mas
ba
stress.
drum? Filipino
Correct.
music is drum. We can have
Ah,
7 different kinds of drum, and the family can join in.
oh, I
Mm.
So
see.
that's one. But the other one, which the men have a difficult, but the women can adjust, is the
Yes.
mindfulness.
Mm.
And the mindfulness, it's with the breathing exercise, they visualize, and then they go to a part of their lives where they were most happy. In
Yeah,
the
but
mindfulness, that's
mm.
one of the technique.
Yeah. But Gina, I want to ask also, sa kabilang banda naman, what are the peculiar stressors for women?
The women,
The
uh,
husband. Joke.
the husband,
Mga hugot talaga.
especially,
There we go na
especially,
ako, no?
okay, I don't want to tell you what company, but there's a company uh, who handle a lot of people in sales. And then the husbands are not used to really staying home.
Mm.
So I think the wives are terribly stressed. But
Mm.
one man told me in a laughing manner, kasi wala nang time sila ma-meet yung mga kanilang girlfriends sa out of town. I was very surprised because the company that was, there's one company who asked me that they have a lot of men and the men are stressed. So I have to write a totally new program just for men. It's a very different program, Lucci, from and Ami. It's a very different program from the women. Very different po.
Mm,
Yeah.
okay. No
Hindi kami nakaka-relate sa ganyang bagay.
But what I want to tell you, can I share with you good news?
Sige,
Okay.
ma'am.
With the program that Natasha Goulbourn Foundation had 3 years ago, we shared it with Bicol University and 7,500 participants in Legazpi. And Bicol University for 3 years have zero suicide. And so
Mhm.
I'm reporting that out of 27,000 students, 3 years of zero suicide. So I think we can make, please give me a chance, and I want to work with whoever are the volunteer psychologists that come along. Please call me up. Let's design programs for the men. Let's design very innovative programs that was never done before, because we can do it.
Mhm.
We are Filipinos. We
Uh,
can do
Mm.
it. I know we can do it. We can do it. I'm very
Ma'am Jean,
optimistic.
before we let you go, why don't you tell our viewers how to get in touch with you, how to get in touch with your helpline, so in case they need anything, they know how to go about it.
Well, I've requested if you can flash the number,
yes, we have the
because now
card.
we have an added number from Globe, which
There
is
you
an
go.
There you go.
international number. Yes. And in the 2919, we have 8 trunk lines, and we have a new Smart, gave us a nice support, and they're giving us also Smart a 1-800 for the
Oh, that's great.
OFW.
Oh,
So
that's
I'm very
good.
grateful
Yeah.
to
Mhm.
Globe, especially to Ernest Koo, who has taken a very nice interest in what we're doing. And we're 9 years old. And I would love to have the 1 million Filipinos just give me a little something in GCash to show the 110 million Filipinos that we know how to care and we know how to love. So,
Right.
but DepEd, my last news before I say goodbye is that DepEd, we are hoping that Secretary Leonor Briones would launch on July 20, 2020, our emotional resilience program for grades 4 to 12. It took us 4 years to do it. And as we were training and pilot testing, out of 11 teachers, 4 had depression.
Wow.
And
Mm.
out of 11 teachers, out of those 4 in depression, 2 had suicidal ideations. And as we were
Ideation.
pilot testing a school in Palawan, there was one we discovered had ideation and a plan for suicide, even the date and how he would do it. A 12-year-old. So this program that we have designed for DepEd, and it will be part of their curriculum, is something I am praying so hard that Secretary Leonor Briones, and I have the support of Senator Win Gatchalian. He's an amazing guy. He believes in the mental health a lot. And he has requested DepEd to hasten this program. And with the COVID and the suicide in Bicol of a 19-year
Yes,
old,
yes.
we really need it. That's the 4th suicide in Bicol in 6 months.
Oh,
Same
wow.
location. For every one suicide, you can have 4 to 11 copycat.
Oh,
So we've
yeah.
got to stop it. So we have a post-vention program. I just need help. If
Mm,
I get funds from companies, I promise you will see us with the help of fantastic doctors. We have the
mm,
best doctors. But for 110 million people, we only have 585 psychiatrists, 1,500 guidance counselor, and 1,800 psychologists.
mm.
We have
Okay.
only 4,000 plus, whereas Australia has 130,000 psychologists for 40 million people. We
Wow.
have only
Okay.
It's a gap
4,500,
that
sir.
needs to be filled. Yes.
Thank you, Luchi.
All right. Yeah.
Yeah,
Thank you
Maraming salamat
also.
po,
Maraming
Ma'am
salamat
thank
po.
Jean
you.
Goulbourn of the
Salamat.
Natasha Goulbourn Foundation. Ma'am,
Thank you
salamat po
so
sa ginagawa
much.
ninyo.
Thank you
Thank
so
you.
much, Chiefs. Thank you
Good
for
night.
having us. We
Thanks.
pray for the
Okay.
Filipino, and we're great. We can handle this. We just need the volunteers. Salamat
We're with
po.
you.
Salamat po.
Salamat,
Okay.
Philippines.
Thank
We
you.
love you. Salamat.
Okay. We encourage those in need of help with their mental health status to reach out to services like Hopeline. The numbers of Hopeline are flashing right now on your screens. Paki-screen cap lang po o kunan ng picture right now, and feel free to call them up anytime. So stay right there. The Chiefs will be right back.
Welcome back to the Chiefs here on One News. Now joining us is Socio-Economic Planning Undersecretary Dr. Juan Antonio Perez, who is also the Executive Director of the Commission on Population and Development, or POPCOM. Good evening po, Doc Jeepy.
Good evening, Ami, and all the chiefs.
Yes, welcome to the Chiefs. Before we go to all these concerns about the population going up, maybe you can give us a situation mark. Kumusta po? 25% daw of rural health, of reproductive health services, especially in the rural areas, has been disrupted by the pandemic. Tama ba yun? And anong impact nun on your program?
Well, we've seen various reports. Most of them are surveys, so they're not covering all the health facilities. One particular report that's relevant to what we do in family planning is that we requested the health facilities to deliver family planning supplies directly to the homes of the women.
Oh,
And
wow.
as far as, yes, because they can't go out. They
Door
can't
to
go
door
out
na.
to,
May
yeah, we're
delivery.
doing it. Yes,
Or ano yun? Yung, ano yung
pills,
binibigay sa kanila?
pills and condoms.
Okay.
Oh. Of course.
And
Sir, mabuting di nagagalit yung simbahan. I mean,
wala akong narinig.
but
Well, I think,
do they know? Do they know? Kasi I
yeah,
would imagine they would be up in arms or in an uproar if they know
no,
about
they're
it.
not. No, we didn't get any major flack from there. I think there was one priest who talked about it, but then we basically the program is just to give pills and condoms to those who are already enrolled.
Okay.
We're not
Okay.
giving it away like candy.
Oh, hindi naman pala
Only for those who are already enrolled. That's around 2
Uh,
million women.
marami-rami
So
na yun,
our
ha?
report, yeah, our report was about 50%. We're able to do it that way. So the other women would still have to go out to the health centers
Pero
during
may
that period.
disruption pa rin. May disruption pa rin. How much disruption to the program as a result
Well,
of quarantines?
a survey that I saw uh, did actually said that about 1/3 of health workers in the rural health units were not able to get to work. So just as the general population can get to the center because of lockdowns, the health workers themselves had difficulty getting to work to the tune of about 30% absenteeism. But I'm sure it was not something that they wanted to do. They wanted to get to work, but
Okay.
so that means the level of service, I mean, in terms of amount, would be reduced. Now, if it is the skilled health worker who's absent, then some services would have to be postponed.
Okay. So, hey, Dr. Jeep, so GP,
Yes.
we are expecting a bump, no pun intended, a bump in unplanned pregnancies. I mean, what are your projections? What are we expecting?
Yeah, early in about late March and April, we were talking about 100 to 200,000 um, increased pregnancies that were unplanned by next year. UP
Mm-hmm.
Population Institute recently came up with some initial studies that were
Mm-hmm.
funded by UNFPA. They have a more exact number, around 214,000
Nako.
additional pregnancies,
Mm-hmm.
because they also predict around almost 600,000 women will not be able to get the supplies that they need.
Oh,
Mm-hmm.
So, one pregnancy for every three women who are not able to get the supplies they need.
right, right. And,
Okay.
and again, what segment of the population are we talking about?
Well, it's the population that's served by our primary healthcare government facilities. So
Mm-hmm.
that would be usually the 40% uh, um, lower socioeconomic status, no?
Mm-hmm.
Yes.
Maybe up to 50%.
Wow.
But of course, the problem is generalized. All sectors of society are having
Mm-hmm.
problems getting supplies.
Mm-hmm.
So we also put our information on helplines. Our people are ready to accept calls from
Nawala.
Ay, sir.
Wala yata.
anyone
Oh,
state.
ayan.
Mm.
Yes, there I am.
Nawala siya.
I'm
Mm.
back.
Yeah, he's back.
Okay,
Yes,
yes.
you're back.
Okay, you're back.
Sir,
Okay,
I'll,
so
hmm.
we have that line so people can, find a way to get the supplies wherever they are. In all our regions, we have numbers and in NCR.
Hmm.
Mhm.
Sir, I'll go back to your numbers kanina. Well, actually,
Yeah.
yung numbers kanina, 214,000. But I think that's based nga on a third of the 600,000 who will not be getting their regular supplies. But
No,
that's only for those who get their supplies. Eh. I mean, what about those who have not been getting their supplies before, but maybe at greater risk now of getting pregnant because they're locked up, at home? Hindi kaya mas malaki pa dyan sa 214,000 yung maging number?
you're right, and we're not actually counting there in that projection the 3
Mm.
million women who have no family, who are not using any family planning method. No,
Mm.
and under the current situation, whether you like it or not, so you could have increased pregnancies just
Mm.
because you're together all the time with your partner.
Mm.
Yes.
You know,
Mm.
so you're at higher risk for a pregnancy during this period.
Yeah.
Um, in
Dr.
that
GP,
case,
yung sa nabanggit nyo, I mean, one would hope, one would presume that under quarantine, it is your partner or at least a single partner that you're having sexual relations with. But does that mean also that the rise in unplanned pregnancy does not come with a corresponding rise in STDs as well, if people are at least sticking to their
mm,
partners?
but that could be, a nice incidental finding. The
Mm.
world has never had a lockdown of this kind. No,
Mm.
Mm.
lockdown is a non-pharmaceutical intervention in terms of pandemics. In time of pandemic, that was
Uh,
only introduced around 2010.
uh,
No? So no one has ever had this experience. It would be a good result, Robbie, if we see
mm,
fewer STDs because
mm,
you're sticking to the one.
mm, mm.
What?
Doc, is there any problem about an increase in teenage pregnancies as a result
Mm.
of the pandemic? Is there any specific study
Yeah.
on this? Meron ba
Well,
ganun data?
yes, UPPI predicted that for every 85,000 uh, teenage pregnancies that would happen normally, it would go up by around 5,000.
But
During the
why?
Mm.
pandemic.
But why?
But
I mean, yung mga
That's right.
teenager, they don't
They're locked up
live
at home. That's right.
together. Yeah.
Oo
Mm.
nga,
So
bakit?
how will that happen?
well, that's why it's not as big a bump as
Hmm.
among
Mm,
adults,
mm,
because
mm, mm.
in the previous surveys we knew that this premarital sex happens at home, and now you have the parents at home,
Yes.
Mm.
and you
So
have less opportunity
Masaya.
to
yes, right.
get away. So potentially it might be increasing, but we would be happy with the lower result.
Mm.
Mm.
What family sizes are we or were we targeting before? Na
Mhm.
it's those families that actually are registered or in your list of uh, families or couples that actually have access to ano ba yan, condoms and pills and so on. And is there now a risk that those with only two kids will probably have three or four if this lockdown continues for, say, another, let's just say, 6 months until the end of the year?
Yes, actually, if you have not decided on the number of children that you have, and you're relying on a method that is commodity based, meaning you have to go to a health center to get it, then you are truly at risk for another unplanned child. So we'd like to encourage women to use the more long-acting methods, because you
Mm.
don't have to go back and forth to a health center. So
Mm.
methods like an IUD, which is good for
Mm.
10 years,
Mm.
Mhm.
or an implant. An implant is good for 3 years. Um, but for those methods, you have to go to the health center to
Mm.
get it
Mm.
inserted by a professional. Now,
Mm.
Which is
hopefully,
something you cannot do now, right? I mean,
Mm.
they
it's
hopefully the authorities would let the women who need that essential service go to the health center. But there's
Oh,
another
pero
problem.
yeah.
Even if
No.
the authorities allow,
Mm.
there is no
Mm.
public transport.
I
There
Ah,
see.
ma-
hindi lang yun, Doc. Even if it's allowed, even if there's public transport, we're hearing this now from hospitals and even from blood banks. Even if they could and even if they had the access, takot yung mga tao to
Yeah.
go to outside of their homes.
Yeah, actually, I visited a health center near our office in Mandaluyong, and the doctor told me that there was a reduction in the number of people from the community going to the health center, which is right in the middle of Addition Hills. Uh,
Mm.
uh,
Yeah.
and there are communities like Addition Hills where you have demographic issues like so many people living in crowded houses. So
Mm.
Mhm.
people, I believe, are more afraid to go out in such communities.
Mhm.
Now
Mm.
that they 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 avoid mingling,
Yeah.
and so you have less health seeking behavior, or people delay healthcare.
Yeah.
Yes.
Mhm. Although,
During
Doc,
that too.
na super lockdown din yung Addition Hills kasi for several days eh. I mean, that was an
Mm.
extreme lockdown eh.
Mm.
Yeah, actually, Addition Hills is the most heavily affected
Mm.
barangay in NCR. They
Mm.
have over 120 active cases in that barangay, and
Mm.
that's where our office is.
Oh, wow.
Actually, Doc, to that point, I'm just curious. Later on, for you who are mining the data, do you think it's possible to draw a direct correlation with how strict a quarantine is for a particular area or even a particular province relative to the rise in unplanned pregnancies?
Right
Maybe.
now, we're
Yeah.
unable to make that
Yeah.
determination
It's too early. Yeah.
because, well, people will not be going out to
Yes.
Mm.
health centers so much. I went to a Mercury
Mm.
and asked whether people are buying more pregnancy test kits, and they're
And
not sure
what
yet.
did I say?
Sabi,
No, not yet. they're not yet
Not
seeing that.
too early
But
yet.
I checked with Fabella. The numbers of pregnancies, of course, are still about normal. But
Mm.
what I heard was in March, they had no maternal death. But
Oh,
in
that
April, they suddenly had three. This was,
in hospital,
ECQ in
in
Fabella.
hospital.
They
Ah,
suddenly had three maternal deaths in Fabella Hospital in Manila. One
I
of
was
them was
going
a
to ask
COVID
you.
patient.
I
Ah,
see, I see. So,
Doc,
my
Mm.
next question nga has to do with maternal deaths
Mm.
because
Yeah.
I'm hearing that there are more home childbirths now than before COVID. Is
Mm.
this true?
Mm.
That what I've heard is that some women are not being allowed to give birth in lying-in clinic, which is where a
Yes.
large number of women go.
Oh,
And then when they go to a hospital, um, they get into a queue. And I know of one mother who gave birth at the triage area of a
oh my.
hospital,
Oh,
and
wow.
she was not admitted. She just went home after being refused in a lying in. The hospital could not admit
Mm.
her.
Mm.
And then we heard about a woman who gave birth at home, a midwife, but she was bleeding. Six hospitals would not admit her. Five hospitals would not admit her, again because of
Mm.
COVID issues.
Yes.
And the sixth hospital where she was accepted, admitted, there she expired.
Oh,
So
wow.
we're trying to work with DOH and local governments to have two paths for, one path for
Mm.
COVID patients and another path for those who have no COVID or you need other essential care that's not COVID.
Yeah,
well,
But
but I mean, Doc, and
speaking
you
of
know, and these are all very tragic cases. But gusto ko lang ikabit doon. Are we able to monitor abortion? And I would imagine if what is rising is unplanned pregnancies, are we also monitoring what the impact is on abortions?
well, when it comes to abortions, we have to wait for hospital reports, no?
Mm.
Because that is where the women who are bleeding and will
Mm.
go
Mm.
for if they're bleeding so much. So I have not heard of an increase yet of that.
Mm.
Although um, things could be happening at the community
Yeah,
level that we
it's
don't know
probably
about. I don't know
unreported. Yeah.
if in Quiapo you can still buy the abortifacient,
Mm.
the pill that
Pamparegla.
causes
Mm.
bleeding,
kaya po
pamparegla
meron,
and such.
Mm. Mm.
Meron, I haven't been able to go to Manila yet,
Yeah.
but
Mm.
speaking of the response to to COVID, you're offering your volunteers, POPCOM volunteers, as contact tracers. Now, I want to just digress a bit. How many volunteers are you talking about? Saka
well,
anong capability na for contact tracing? You're asking the LGUs to tap your volunteers as contact tracers. Mga ilan ba
yes.
yung volunteers na yan? Ano yung competencies nila to do?
Well, the health volunteers and population volunteers are used to going house to house. They know the people in the community, and they can easily trace people that that they live with day to day. So we had a discussion with DOH, DILG, NEDA itself, and POPCOM, and we agreed that this was in April 30. The four agencies issued a directive to all local governments to organize contact tracing teams using the volunteers.
How
And
many
for local,
volunteers?
well, there are 200,000 barangay health worker volunteers and 10,000 population volunteers. So they would be the base for that. So our thinking was that each barangay should have one. We also
Mm.
gave information to local governments on which communities, which barangays are at high risk for COVID because of congestion. Here in NCR, 30% of the population lives in housing that is 20 square meters or less. And the
Yes.
average number of people there are 4 or 5. So that means that leaves you with 4 meters or less living
Mm,
space. That's as big as a ping pong table. So
Mhm.
mm,
the possibilities of COVID in such communities where you have high numbers of those houses and for it to spread is higher.
yes.
So we were recommending that you should do surveillance, make sure that if barangay does not have a case yet, you keep it protected. No?
Mm,
Patibayin ang kakayahan ng barangay na labanan ng COVID. So we're approaching it from that point. And yung volunteers, aside from delivering family planning supplies, they would also support, the contact tracing and surveillance because they're all health workers anyway.
yeah. Wala bang upside tong COVID in terms of, say, sex education? Naghahanap ako ng good news, no? Because families are now together. Wouldn't it be good for parents to actually take on the role of the educator, especially in the subject of sex? Because that will help the PopCom program over the long run, right?
Yeah, our hashtag is mag-usap tayo sa family planning. And that
Mm,
Mm.
that does not only apply to us but also to parents. Talk among themselves about family planning,
Mm.
about responsible parenthood. Talk to their children
Mm.
about life, and
right.
just
Yes.
Mm.
listening to young people,
Yeah.
keeps them out of trouble in a way.
Right.
We're
Yeah.
also sponsoring online, activities for young people in our
Mm.
regional offices, and young people can sign on and get prizes. So that's happening in some areas. We're coming up with that. So
Yeah.
we hope that our online platforms click some more with the people. So that's where
Yeah.
I think that's where health services,
To
social
moderate
services
the,
have to
ano,
go.
to moderate
Mm.
the raging hormones, sabi nga.
Yeah.
Yes.
Luchi, matutuwa yung mga kabataan na nanonood dito na alam na nila kung anong pag-uusapan sa bahay nila. Kasalanan po ni Luchi Cruz Perez pagka
Ay,
kinausap kayo ng parents niya.
tulong ko yun sa mga magulang.
Hormonal.
Okay, Usec, Doc Jeepy Perez, the third Executive Director of Popcom. Sir, maraming salamat po, Doc, for joining us tonight.
Thank you.
Thank you all. Stay well, good
Salamat po.
friends.
Stay well
Stay
po,
Happy
well
and
and
thank you for
weekend.
healthy.
joining us.
Bye.
All right.
Okay, it's a
Okay.
Friday night. Tatlong araw na lang at Lunes na tayo.
Nami-miss ko na po yung happy weekend mo.
Happy
Monday to
weekend.
Friday.
Okay, happy weekend. Okay, that's
Happy
a
weekend.
wrap for tonight. Okay, you can also catch One News on the Signal Play app. Register for a free account now at www.signalplay.com and stream One News live anytime, anywhere. And that will be all for this special edition of the Chiefs. We hope what was discussed here will keep the conversation going. I'm Edlinga of One News.
I'm Mami Pamintuan of the Philippine Star.
I'm Luchi Cruz Valdez of News 5.
I'm Robbie Alampay and we are One News.